So what we're trying to do is basically introduce what Parkinson's disease is, but also go over some of the do's and don'ts for emergency personnel when they're called into the home of somebody with Parkinson's disease. So Parkinson's disease occurs because there's lack of dopamine in the brain. That's a very important neurochemical in the brain, and it presents with four main symptoms. You have tremor, you have muscle stiffness, you have slow movements, and you have changes in the way you walk and in your balance. So those are the four cardinal signs of Parkinson's. But as the disease progresses, you can have other symptoms, involuntary movements called dyskinesias. You can have trouble with memory and cognition. So it's a whole range of symptoms that patients present with. So some of the things you might see are, on a physical standpoint, you might see somebody with a lot of tremor, or they may have trouble getting out of a chair or walking, especially if their medications have worn off. We call that the off state. The other issue is, as the disease progresses, once you've had Parkinson's for 7 years, 10 years, maybe longer, you start to have cognitive issues, including dementia or memory issues. Sometimes it can present with agitation. So learning how to handle that while at the same time not making the Parkinson's symptoms worse is a very important thing to know about. You know, a lot of the times emergency personnel will use Haldol, which blocks the dopamine system, in order to control agitation. For Parkinson's patients, that is not a good drug to use because they stiffen up so much to the point that their muscles might start breaking down and they'll have other complications. So to avoid using Haldol, but to use, for example, benzodiazepines as a way of reducing agitation is a better way to go. So in general, if there's a medication you have to use, go ahead and use it, but use it with caution. One medication that is often used for pain control, which is more of a strong contraindication, is something called as Demerol. So avoid Demerol for pain, but if you have to use opioids or narcotics, you can use it, but understand that sometimes you may have issues, especially in terms of paradoxical agitation with these patients. Probably the most common one you will run into is called Sinemet, or it's also called carbidopa-levodopa. But the range of Parkinson's medications has grown quite a bit. So there's about 10, 15 different medications that you might find in a pill box in somebody with advanced Parkinson's. Some other medications are used such as Mirapex or Requip. Sometimes you might find patients with a skin patch called as Nupro. There might be other medications that are used as injectables by some patients, such as Apoquin. So again, there's a whole range of medications that you can run into. Most commonly, you will run into hypotension, too low a blood pressure, because Parkinson's itself affects the autonomic nervous system that leads to low blood pressure. The medications, for the most part, lead to low blood pressure, so hydrating the patient well is a priority. Occasionally, due to a drug interaction with medications called as monoamine oxidase inhibitors, you can have a very severe spike in the blood pressure. So lowering the blood pressure in those cases will be important. Again, you have to evaluate the patient in front of you, as you always do, and tackle it on a case-by-case basis. Alzheimer's is a very different disease state, but Parkinson's patients can have trouble with memory, and sometimes when the dementia gets worse, they can have hallucinations or delusions. One practical method is to use redirection methods. If the patient is having a delusion, don't try to correct them on that, but try to redirect them, try to steer the conversation to a different level so that their agitation goes down. And again, using medications like benzodiazepines in the acute setting can be reasonable, but try to avoid Haldol, which blocks the dopamine system. One thing I would like to spread the news is that Parkinson's these days, as I mentioned, there's a long list of medications. There's also surgical treatments, including deep brain stimulation, which is like a pacemaker for the brain. So that might be something you might encounter as an emergency person, where you might see evidence of a pacemaker, but it might not be a heart pacemaker, but it might be a brain pacemaker. And if that shuts off accidentally, the tremor may suddenly get worse. So that's something to be aware of with respect to these patients. Also, one of the things that I would mention is sometimes patients with Parkinson's have dyskinesias, and this is a severe involuntary movement. Sometimes they're mislabeled as being drunken or confused, when all they're having is this physical movement, which is a side effect of the medication. So try to weed out the difference between somebody who's having intoxication versus somebody who's having dyskinesia from their Parkinson's. So in terms of transporting the patients, for the most part, there's no particular contraindication to moving them, unlike, say, for somebody you're suspecting a cervical injury. So you can feel free to transport them, try to, again, assist them, because if they're in an off state, they may have trouble walking or even getting to a wheelchair, so they may need more physical assistance to do so. But in general, there's no particular contraindication to how you move them.
Parkinson's disease awareness is important to us at Palm Beach County Fire Rescue. The information provided in this video should help you if you encounter one of these patients in the near future. That's it for now. Thanks for watching and stay safe.